Large pores. Large pores is a big concern for many people, and I have a lot of patients coming to complain of large pores and seeking treatment for that. To understand the extent of the problem, we have to understand that large pores are coming or originating from two areas in the skin, but we have before that to understand that this is a normal structure of the skin. Pores of the skin are the opening of the hair follicles on the skin, and the sweat and sebum is coming out from those pores, so it's normal to have those structures in the skin. And when we have clogging or closing of these pores, we are going to have problems like acne, and this is something which is not required. When we get large pores, this means that when we are exposed to the sunlight and the other injurious agents which is affecting the skin negatively, our epidermis is starting to have different structures where we have hyperkeratosis. The number of dead cells on the skin is going to increase on the expense of the living cells, and with this we are going to have a problem because the skin is going to have much more transepidermal water loss, and this means that the skin is losing water. When the skin is losing water, the elasticity of the skin is impaired, so we start to have large pores on the skin. To deal with that, we need to do different things, procedures, like using retinol containing products, which should be used for 6 months or more, but it has to be used gradually so that it does not cause irritation. Chemical peels can be used in order to decrease the hyperkeratosis and normalize the structure of the epidermis. Also, we can do microdermabrasion, which is one of my favorite techniques because it's mechanical. It does not cause side effects or hyperpigmentation. It should be used in 4 sessions, once every 7 to 10 days, and after that we need to repeat it every 3 months in order to maintain the epidermis in good shape. We can use laser peel, which might be associated with some irritation or erythema to the skin, and it can cause hyperpigmentation if we didn't protect the skin against this hyperpigmentation. So all those are procedures in order to normalize the epidermis, and this is something which should be maintained because the epidermis is the layer of the skin which is exposed to the environment, and it is always subjected to wear and tear. The other reason of having large pores is the loss of collagen, which starts from the age of 20, as every year we lose 1 to 2% of our body collagen, and when we have a significant amount of collagen loss, then we start to have impairment of the firmness of the skin, and we start to have large pores and fine lines and wrinkles and so on. So at that time we have to do something to stimulate the collagen, which can be dermal needling, it can be micro needling radiofrequency, fractional lasers, or the non-ablative rejuvenation using the Nd:YAG laser, which is one of my favorite techniques because it's associated with no downtime and because it covers 100% of the surface of the skin, so it stimulates the collagen in a very nice fashion with no side effects, with no downtime, and it is very safe. So in this case we usually need 3 sessions, once every month, and the collagen is going to be deposited in 3 weeks, and then we keep improving the skin condition within 6 to 8 months after we do the procedures. So those are the modalities in order to deal with the large pores in the skin, and it's very important to combine both the epidermal approach and the dermal approach in order to have significant improvement in the pores.